Have you ever thought about doing hyperbaric oxygen therapy but didn't know where to start? In this short video, we're going to talk about hyperbaric oxygen therapy, or HBOT for short. We'll cover what HBOT is, the two main effects that it has, some of the conditions that it affects, and also 3 different ways that you can experience hyperbaric oxygen therapy. First, what is HBOT? Hyperbaric oxygen therapy is where a patient goes in a pressurized chamber where they breathe air or varying amounts of oxygen, where the pressure is anywhere above 1 atmosphere. A British physician named Henshaw first used hyperbaric oxygen therapy in 1662 as a medical therapy. During the 1960s, studies started to show many beneficial uses of hyperbarics. Since that time, multitudes of people have found hyperbarics to be both beneficial and effective. As you can imagine, increased oxygen has a positive effect on the body, but did you know that increased pressure can also have a positive effect on the body? Both were found to turn on or turn off genes. If I was going to tell you one thing about hyperbaric oxygen therapy that you'd remember today, it's this. HBOT decreases inflammation and it also decreases swelling. Increased inflammation and swelling are seen with most diseases and wounds. So anytime you have decreased inflammation or decreased swelling, it's a great thing. In addition to decreasing swelling and decreasing inflammation, there's many other ways that hyperbaric oxygen therapy helps heal the body. We'll talk about those other ways on various future videos on YouTube. Let's now discuss what conditions can be helped with HBOT. There are both traditional indications and non-traditional indications. The traditional indications are 15 approved conditions that Medicare covers. Every one of those Medicare approved conditions are a different type of wound. And those wounds can vary from flesh-eating wound to carbon monoxide poisoning. It could be a crush injury. So a lot of times they're just pretty much a list of nasty wounds. Could be a burn. These conditions are frequently seen in a hospital setting. Globally, 130 conditions are collectively approved by various countries. The amount of research supporting the use of hyperbaric oxygen therapy is amazing. The non-traditional indications or conditions, while not covered by Medicare, are still helped by HBOT. Some examples include anti-aging, autism, long COVID, post-stroke, and traumatic brain injury. Other conditions include dementia, post-surgical, Lyme disease, mold toxicity, and PTSD. The list of non-traditional indications is a long list and too long to actually mention right now. HBOT is done in a hyperbaric chamber. There's mild hyperbarics, which is done in a soft-sided chamber, and there's hyperbaric oxygen therapy, which is done in a hard-sided chamber. The soft chamber has one setting, 1.3 atmospheres. What's an atmosphere? Well, if you're at sea level, the weight of 60,000 feet of air above you creates 1 atmosphere of pressure. The hard-sided chamber can be at 1.3 atmospheres. It can be as high in our clinic as 2.8 atmospheres. Most patients in our hard chamber are anywhere from 1.5 to 2.4 atmospheres. Each of these different pressure levels allows us to give a different dosage for what the patient needs. Now, in a soft-sided chamber, you don't have as much pressure, but it's often said that you can make up in time what you don't have in pressure. So we can have more sessions, let's say, in a soft chamber and make up what we don't have in that higher pressure in the hard chamber. So these are 2 different ways that you can experience hyperbaric oxygen therapy in our office. You can go in the soft chamber, you can go in the hard chamber. We have a 3rd way that you can experience hyperbaric oxygen therapy, and that's our rental chamber. And that's a soft chamber that again goes to 1.3 atmospheres, and we set that up for your home use so that you can use this for your home. We actually had this in a house recently, this earlier this year, where an 18-month-old girl had a concussion, and now they're 2 hours and 15 minutes from our clinic, so it was not going to be convenient to drive up to the office for a session, what we call a dive in the clinic. So we brought that rental chamber to their house, we set it up, and they had that chamber in their house for 2 months. And by the end of it, that little girl was Now she's 20 months old and she was at 80% improvement. So they were really happy with that. It was a great progress that they saw. I hope this video has helped you learn more about why you should do hyperbaric oxygen therapy. Hey, and if you want to know more about DeLorey Chiropractic, check our website, which is listed in the description below. If you have any questions about the topics we talked about today, you can leave those in the comments. If you have any suggestions on future topics that you'd like to hear covered, please also, you can put those in the comments. As always, it's been a pleasure to talk to you today. We look forward to talking to you again next time.